Okay, how many people here today would say that over the past couple of years they have struggled with being overwhelmed, overstressed, maybe anxious, discouraged, and depressed? Yeah, pretty much everybody. That's what I thought. You know, when I was a kid and I was in school, we used to see movies about how modern technology would make our lives simpler. Well, we got the modern technology thing going, but I'm not sure how much simpler our lives are. You know, they kind of follow us wherever we go. One of the questions that I'm asked quite frequently is what causes anxiety and depression? Well, to borrow a line from my friend Daniel Amen, asking what causes anxiety and depression is kind of like asking what causes chest pain. When you go to the hospital emergency room, they don't give you a diagnosis of chest pain because chest pain could be caused by so many different things. Could be cardiac, could be pulmonary, could be skeletal, could be muscular, could be gastric. And unless you do some investigation into what the root cause is of the chest pain, you wouldn't know how to effectively treat it. For example, if you just guessed and you gave someone a muscle relaxer when in fact they were having a heart attack, you could kill them. Well, the same is true for your struggle with anxiety and depression. Unless you do some investigation into what the root cause is of your struggle, you won't know how to effectively treat it, how to manage it, how to deal with it. And anxiety and depression is different for every person. It is not a one-size-fits-all thing. It doesn't have one-size-fits-all causes, and there are not one-size-fits-all cures. Yours may not look like hers, may not look like his, may not look like mine. Your struggle with anxiety and depression may have its roots in biological causes, psychological, social, or spiritual. In fact, it could be one, two, or all four of those areas. Everybody's formula is different. And today we're going to do some investigation into those areas of your life: biological, psychological, social, and spiritual. And I don't want you to get nervous. I'm not going to preach at you, but it is important to take a look at what you believe and why you believe it. We're going to take a look at those four areas and figure out how you can best treat, how you can best manage your struggle with feeling overstressed, overwhelmed, anxious, and depressed.